Nice to meet you. I'm Eyal Baum. I'm the Director of Strategic Accounts from Tyto, responsible for business development and partnership for Tyto outside North America. And I will present today our company, which is a telemedicine company, already sailing for more than 3 years now. So let's dive into what we are doing. So just as a background to telemedicine, telehealth today is quite booming. It's one of the hottest trends in digital health today. You can see here numbers from the US. Governments are now sponsoring it and approving it to provide virtual care and reimbursing it at the same amounts as a physical visit. We see it in the majority of the states in the US. We see it also in Europe, in the UK, France, Germany now joining, Sweden. So we see this trend. It's beyond just a hype. It's really moving forward into really another alternative of delivery of care. And this is our business. We see many employers now offering telehealth, insurance company. So this trend is happening already now. It's not the future. But if you look at telehealth, if you look, many people understand the value, say they need it. Many people have access to it. 70% have access to telehealth as part of the health plans or employer benefit. But if you look at the actual usage, whether people, when they are sick, whether they still going physically with all the hassle and time spent and money involved in going at night to an urgent care or an A&E or an ER, people are still doing what they've done for many years. And if you look at the actual usage of remote care, of telemedicine, it's still 5%. So it's still low. And we have tried to understand what are the main reasons people are still do not go into the efficient, easy, and fast way of getting to a doctor and who can provide me care. And the main reasons are basically two, as far as we understand it. One is the lack of clinical capabilities. That the doctor, when you are doing a remote consultation, a video or a phone-based consultation, the doctor does not have the same capabilities he has in the clinic. And this leads to lack of trust. People still, it's healthcare, they need to trust it, they need to trust the doctor, and they need to trust the care and the treatments they got. And Tyto Care, we provide a full medical kit. Basically, this kit sits at your home. It's a full diagnostic, FDA cleared, CE cleared medical devices that enable a remote physician, a GP, a pediatrician, family physician, to not only talk with you and see you over a video conference, but really to examine you, really to have the GP have the confidence to provide you full treatment. And also for the consumers, for the patients, they are engaged, they are part of their treatment. They see they are performing their lungs exams, they look at the ears, they look at the throat, they are more engaged in the treatment, they trust it much more. By the way, it's not only a device, we are not only a device company, we have a full platform as a telehealth solution in order to provide a remote physician with a patient at home, or by the way, or a nurse in a clinic for home care, for example. We need the full platform to connect between the point of care and to the physician. It's a modular design. Basically, this is like the base unit. It's connected using Wi-Fi. Not enough room here. But you can connect, for example, a stethoscope, and then you put it on your chest, let's say, for lungs auscultation or heart auscultation, and the remote doctor will tell you breathe deep, and he will be able to listen to your lung sounds if you have a suspicion of pneumonia or if you have an asthma attack or COPD conditions. So the platform consists of a doctor's app, patient app, a mobile app, and a device. Everything is connected to our cloud platform on Amazon, and we integrate with EHR or other telemedicine platforms. So eventually the recordings and the data is accessed via the medical record for continuity of care. And we know, and some of our customers use our telehealth solution as end-to-end, including our video conferencing and our mobile app, and some of our customers are integrating our platform into their existing solution. For example, American Well or Teladoc or Clalit in Israel. have already done that. How it works, basically we have two main workflows, two main interactions between a patient and a doctor. One is the online, is the live examination that you're doing a video consult, and in parallel, the doctor is controlling the device remotely and gets live sounds, video, images, and vitals from the device. This is one option. Some doctors prefer to work on that way, so it's more closer to the real world physical visit. And in addition, we have the asynchronous, the offline, what we call, is that you can collect the data. And one of the unique advantages of Tyto is that we have guidance with AI and a lot of algorithms to allow anyone to do those examinations. You have a lot of blood pressures or thermometer in the market, but a lungs or throat or ear exam, those are qualitative examinations, so they require some skills. So we need to teach the parents, the mom, dad, how to do the examinations, and also give them ongoing feedback on the quality of the examination to make sure the needed sound of the heart or lungs, the needed image of the throat, the tonsils or the eardrum is achieved. And you will see it in a video in the next slides. So you can see here is the mobile app that guides you and gives you ongoing feedback using our AI and algorithms. Here is an examination, a demo video. So you look, the mom is, let's say the kid has an ear pain at night. So the mobile app both give her some tips how to do it. And during the examination, the app and the device guides in the canal and identify the eardrum. So the mom that usually don't know how an eardrum looks like, we give her with the app and the device the confirmation that the needed image is achieved. Same goes for the throat. We need to verify that the kid opened his mouth wide enough. If otherwise, we will tell the mom to use the tongue depressor. And once the tonsils are evident, we give them identification of the tonsils to verify the doctor will be able to diagnose or to provide treatment. And that example is a lungs examination. We are recording sound of the breathing sounds, and we give ongoing feedback. You see the green indicator that tells we identify the breathing sounds, and otherwise we give notification if you spoke, if you moved it and create some noise, we will give you immediate alerts how to improve the quality of the data. And as we said, we have another mode of operation, which is the online mode. What you see here is from the physician side, from our clinician app. So the doctor is doing a video conference. You see the doctor, how he's doing the examination, how the kid is doing, the mom on the kid, let's say. And you cannot hear it, but now at the moment he gets live sound from the patient's heart or lungs. Tell him to breathe, we can record it. We get the heart rate, we can apply filters to improve the sound. It's a digital stethoscope, so we can provide, in many cases, even better sound than a regular analog stethoscope. Okay, and this is now, the physician selected the throat exam. So the device streams data live to the clinician app. Tell him, open your mouth wide, say and look for the tonsils if they are red or have some white exudates, etc. And again, last example is the ear. So we really provide the physician a very good experience, much similar to the physical visit, to the physical world. And we see feedback from doctors saying, now I have much more confidence in providing treatment. I'm feeling I can treat much more conditions, not only limited to very narrow and a small amount of condition, but really we are like closing the gap between the physical and virtual, that we give the physician the same confidence in providing remote care. So you can see examples of the common condition that Tyto is relevant. Basically, it's for primary care or pediatrics, but including some chronic condition could also be relevant as well for the lungs or heart, and some of them also skin, etc. But this is not limited to that. Basically, any primary care setting could be used with Tyto. In terms of the product lines, basically we are separating it into home use by what we call Tyto Home, where the family buys the kit, it sits at the home, and whenever one of the family members gets sick, gets online with a remote physician. Some of our customers are even subsidized part of it, so the cost for the end user many times is even lower. By the way, it's even today in Best Buy at the US, offered to all US citizens. And we have the Tyto Pro. Many of our customers are using it in a clinician-to-clinician settings, which means a nurse, let's say, that's visiting homes, like home care. It could be a paramedic in an ambulance. It could be a pharmacist in a pharmacy, or a teacher at school. All of these examples in use cases, we already have customer using this type of usage with the Tyto Pro. You can see an example of some of our partners. We are working on a B2B2C model. So today we are not selling directly to the consumers, but partnering with health system, health providers, insurance companies, or anyone that provides a telemedicine service and want to expand it and to offer better service. So you can see a glimpse about, we began, by the way, with more, 2017, we began more with the professional to get the trust and confidence and engagement from the health system. And during the last year and maybe even a year and a half, we went more directly to the consumers, both with Clalit, for example, in Israel, which is offering Tyto for more than a year now with very good traction. The US Oshner or Sanford or Novant, Avera, Kaiser Permanente, they're using it also quite in large scale. In Europe, by the way, we've got the CE mark. UK specifically, we've already done a few pilots, nothing big yet, but we have started in other countries like Switzerland, France, Sweden, to go beyond pilots. Few numbers, you can see our device is already quite, the company exists for 7 years, we are in the market 3 years, so we already gave good traction in Israel and US, and now starting in Europe as well. We have about 60 different health systems already offer Tyto in different use cases. Last slide, just about the company. Today we are located in Israel and the US. We have about 70, a little bit more employees. In terms of investors, you see some of them are insurance companies like Ping An, Good Doctor is the telemedicine provider, and Cambia. Orbimed is one of our main investors. Walgreens invested in early stage, and we are towards another round of investment soon.